Thank you very much. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, city council committees are currently meeting remotely. We are using Microsoft Teams to make these remote meetings possible, and instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligentsia prior to the hearings, and can also be found on phlcouncil.com. I now know that the hour has come. Clerk, will you please call the roll to take attendance? Members that are in attendance will please indicate that you are present when your name is called, and also please say a few brief words when responding so that your image will be displayed on screen when you speak. Madam Clerk?
Councilmember Heenan. Councilmember O.
I am present. Good afternoon, Chairwoman and council colleagues.
Councilmember Gim.
I am present. Thank you, Council Chair. Madam Chair.
Thank you.
Councilmember Green.
I'm present in the same location I was all day.
Still there.
Councilmember Thomas.
Good afternoon, everybody. Good afternoon, Madam Chair. I'm present.
Good afternoon.
Councilmember Brooks.
Good afternoon. I'm present.
Good afternoon.
Chair Bass.
Good afternoon. I am present.
We're also joined by Council Members Quinones Sanchez and Councilmember Squilla.
Very good. Thank you. And this is the public hearing of the Committee on Public Health and Human Services regarding Resolution 200403. Madam Clerk, will you please read the title of that resolution?
A resolution authorizing the Committee on Public Health and Human Services to continue to hold hearings to assess the City of Philadelphia's efforts as coordinated by the Managing Director's Office and Human Services Departments to prevent and treat abuse, addiction, and disease related to the use of opioids, and to assess the city's response to the 2020 Restorative Investment Plan for Kensington Residents.
Thank you. Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for the questions or comments they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. Before we call the first panel, would the sponsor of the resolution, Councilmember Maria Quinones Sanchez, like to make an opening comment?
Thank you, Madam Chair, and to all the members of this committee. This is, we've had about a half dozen hearings of this. This resolution was reintroduced after we started our new session, and I want to thank you and this committee for allowing us to have this space to record the progress and challenges of Kensington. I want to thank everyone leading to today's hearing, particularly the residents who you will hear from directly and the administration. All of us agree that this has been an all hands on deck effort with Project Resilience, the emergency declaration by the mayor. But we also agree that if you rode by Kensington today, many would say, and I know the residents you'll hear from will say, our containment strategy has been a failure. The quality of life of the residents of Kensington pre-pandemic were already precarious with a hepatitis A scare, trash vandalism caused by our inability to have a very focused and targeted public safety strategy and human services strategy for the folks that live in the street. I want to thank my council colleague, Councilmember Squilla, on this. We have been a tag team on this, and I appreciate the fact that he has been incredibly willing and supportive to meet with me and stakeholders at all hours, whenever possible, to move this project forward. I want to thank the police department and the streets department in particular, because when everything else does not appear to be working, the residents have counted on them, police, to protect them when they can, and streets department to come and just clean what has become an untenable situation in Kensington. I want to thank our new managing director, Tumar Alexander. He has been working on this project for a number of years, and his commitment to understand that when we do something and it doesn't work, we don't continue to do the same thing and expect a different outcome. We have to pivot, we have to change, and more importantly, we have to hear the residents. I think what folks will hear today is a renewed commitment that we have to change and that we have to listen to the residents, and we must restore the quality of life for Kensington. And that's why today's discussion is about the Restore Kensington plan that was put forth in March of 2020, has been updated in June, and that now really has some action steps behind it. So thank you to all of you folks. I know Councilmember Dom has personally been out there to Kensington, and you have, Madam Chair. Thank all of you for your patience as we talk through this very critical issue. Opioid addiction is a citywide problem. Opioid addiction is a citywide problem. Kensington cannot be the only place where we pilot and we use a poor community to try initiatives at the expense of poor residents who are trapped and don't have a choice. Thank you, Madam Chair.
Thank you, Councilwoman. And I want to thank you for your many years of dedicated work and service to the community. We spoke over the summer about some of the concerns that you had about Kensington, and you invited me to take a ride down and take a look around. And I happened to be in the area nearby. And so I said, well, let me just, swing through real quick. And, I was surprised. I was surprised that, we as a city have not made, in my opinion, the level of investment that clearly needs to be made. In no other part of the city would this be allowed to exist. And it should not exist in terms of the lack of resources that are pumped into the community. I think that there's a lot more that we can do. I don't want to suggest that the city has done nothing. But I do think that this has to be, we need to treat this community as if it were Chestnut Hill. So if we were in Chestnut Hill, there would be a different level of expectation in terms of what is happening and what would be found acceptable. And so, again, I just really want to thank you. I look forward to hearing from the administration. And I look forward to our committee, through your leadership. I look forward to working with the administration, not working against, but working with the administration. How can we be helpful to you to address this human problem that is just really has spiraled out of control? So, again, many thanks to you, Madam Chair. Before we have the clerk call the first panel, is there anyone else on the council committee who would like to make an opening statement? Okay, seeing none, Madam Clerk, if you could call forward the first panel.
Tumar Alexander, Managing
I don't know if you can
Director.
hear me, Madam Chair.
Say again.
Can you hear me?
Mark, is that you?
Yeah.
Okay, yes, we can hear you. Go ahead, Mark. Councilman Squilla, excuse me.
Thank you. You heard from Councilmember Sanchez and how important this is, and this is a citywide problem. Yes, it is overwhelming in the Kensington area and parts of our district, but we see this as it's progressing, not only in Kensington, as it's starting to
Yes.
go and grow into other neighborhoods and other areas, that we really need to get a handle on this. And that's why it's so important to have this hearing and also to have the policies in place that the city of Philadelphia can adhere to, and that everybody knows what can and cannot be done. And I think the challenges that we see today in Kensington will be the challenges in every neighborhood across the city in the future. So we need to really get a handle on it. We need to put our foot down, and we need to make sure that these resources that are being spent in Kensington, after we do this, will not be spread into any other community. So it's really important right now to have this in place, and nothing's better than to have this hearing, Madam Chair, and I appreciate your help and your willingness to participate in this. So thank you.
Absolutely. You know, and not to belabor the point before we call the first witness, but I do want to point out over the summer, I had a chance, one of my books that I was able to get through this summer was a book about a young woman who was from my district who was caught in the throes of opioid addiction. And unfortunately, she lost her life to it. And the book was, I think it's Even If Your Heart Would Listen. By Miss Schiller, who I know has done some advocacy work on this issue for many moons now since losing her daughter, and actually while she was in the throes of it. But that shows the reach of opioid addiction, and it's not just in Kensington. So I just want to make sure that we're all clear on that. I know we all get it, that this is beyond Kensington. It's in a neighborhood near you. And so the point of this is to, how do we put the resources in front of it in Kensington, in Germantown, and West Mount Airy, whether you're in one of the most challenged neighborhoods or a neighborhood that is much more affluent. So, but I thank you, Councilman Squilla. I thank you for your comments. Is there anyone else from the committee who would like to make an opening comment or statement? No? Okay, Madam Clerk, if you could call forward the first panelist or first panel.
Tumar Alexander, the Managing Director. Eva Gladstein, the Deputy Managing Director for Health and Human Services. Noelle Fosstein, Director of the Opioid Response Unit. And there are also 4 additional people from the administration available for questions.
Very good.
Who are Keith Warren, the Deputy Commissioner of the Streets Department, Captain Francis Healy of the Philadelphia Police Department, Dr. Jill Bowen, the Commissioner of the Department of Behavioral Health and Intellectual Disability Services, as well as Liz Hirsch, the Director of the Office of Homeless Services.
Excellent. Thank you. If we could have Mr. Alexander, if you could state your name for the record and proceed with your testimony.
Good evening, Chairwoman Tumar Alexander, Managing Director, City of Philadelphia.
Good afternoon.
Good afternoon.
That's all right.
Good afternoon, Councilwoman Bass and members of City Council's Committee on Public Health and Human Services. I am Tumar Alexander. Joining me virtually is Deputy Managing Director Eva Gladstein and Noelle Fosstein, the Director of the Managing Director's Office Opioid Response Unit. We also have senior officials from the administration, as Sabrina just listed, that's available, will be helping out answering questions. We are pleased to provide testimony on the status of our opioid response efforts and updates on our Restore Kensington Action Plan in response to the 2020 Restorative Investment Plan for Kensington Residents. We established the Opioid Response Unit in February 2020 to aggressively address the opioid epidemic, including targeted response activities in the opioid hotspots of Kensington, Harrogate, and surrounding communities. The ORU is focused on citywide opioid response strategies, opioid hotspot strategic coordination, and alignment of resources across the Managing Director's Office clusters and city departments. The ORU combines the implementation of the Mayor's Task Force to combat the opioid crisis recommendations and the Philadelphia Resilience Project best practices and lessons learned to enhance and improve standard operating procedures within city government. Both the ORU and the Restorative Investment Plan for Kensington Residents were impacted by the fiscal year 21 $750 million budget shortfall. MDO's budget cuts also delayed the build out of the ORU staffing unit. The Restorative Investment Plan was not funded prior to the FY21 budget finalization. Funding any initiative that do not already have budget resources allocated FY21 required trade-offs with other parts of the budget. The administration reviewed the Restorative Investment Plan this past summer and produced the Managing Director's Office Restore Kensington Action Plan. The MDO plan identified 4 action goals with 16 action items that the administration will prioritize for budget negotiations with the intent to implement by Q2 of fiscal year 21. The action goals are as follows. Number 1, increase public safety. Number 2, increase quality of life. Number 3, connect individuals to services. Number 4, increase access to housing. The administration received the updated Restorative Investment Plan in December and will provide an updated MDO MDO Restore Kensington Action Plan to the community in January. The following updates references the current action plan. Under action goal number 1, increase public safety, launch of Kensington Special Services Police District, phasing in 40 officers on foot and bike patrols mid-January 2021 at a temporary location while the administration finalizes the lease for permanent space to launch in early fiscal year 22. The Kensington Police District is an integral piece of the ORU public safety strategy, as it will increase capacity to provide community policing interventions and assist with targeted narcotic disruption and sustainment after operations. Also under action goal number 1, implement coordinated diversion model, planning and scoping now to pilot in the East Division with East Service Detail officers. Coordinated diversion enhances the ability for Philadelphia Police to disrupt nuisance public behavior, focusing primarily on open air drug use without wide involvement in the criminal justice system for low-level offenses, hopefully leading folks to crucial treatment services. Also under action goal number 1 is expanding the police-assisted diversion and co-responders model. Funded expansion is underway in both the 25th and 26th police districts. And lastly, under action item 1, rebooting of the Safe Corridors program. Right now, scoping and planning are underway for return to in-person school. Plan will include daily co-response clearings of school properties before and after school dismissal. Action goal number 2, increase quality of life. Encampment policy, tenant structure policy finalized across city departments, finalizing enforcement procedures with the Managing Director's Office of Health and Human Services, Office of Homeless Services, Department of Behavioral Health, Philadelphia Police Department, and the Managing Director's Office of Criminal Justice to ensure that an interagency effort to deter encampments and minimize the role of police enforcement wherever possible. Also under action goal number 2, increase sanitation services. Recently we've completed 3-week coordination of quality of life initiatives in September 2020. Continuing coordinated work with expanded commercial corridor cleaning with CDC partners and enhanced cleaning in the community with support from the city's council funding for commercial corridors. Additionally, public health funding and expanded cleaning program that operates 7 days a week, 12 p.m. to 5 p.m. and also includes a hazmat cleaning team to address issues around human waste and disinfect targeted locations. Expansion of same-day pay program funded through FY21 and each cohort of the we're funded through FY21. Each cohort of the program participants are both community residents and individuals experiencing homelessness. Lastly, under action goal number 2, pilot community dumpsters. Currently, we have funding from the Community Life Improvement Program, coordinating placement, monitoring, and collection of discarded waste and refuge. This is a way that we hope to limit the amount of trash that's in and around that community. Action goal number 3, connect individuals to services. Connect individual to services, my apologies. Funding, formalize a seasonal pilot into year-round initiative. Kensington coordination strategy. Eva will provide additional information on the strategy in her testimony. Additionally, the ORU Interagency Data and Analytics Work Group will create a dashboard to track outreach and engagement efforts in Kensington across providers. Finally, action item number 4, increase community investment. Working with other partners, developing McPherson Square strategy, planning and scoping now to finalize an implementation plan for spring of 2021 to ensure public space is both safe and secure for community residents and our young people. Provide dedicated funds for basic system home repairs to address vandalism. Funded that, and that's, I'd like to thank Councilwoman Sanchez for helping push that funding through the current mid-year process. We look to work with both the Councilwoman and a community-based partner on creating and establishing that program soon. Targeted basic systems home repair program that's funded through fiscal year 21, and modular housing pilot program, still exploring that concept. Budget resource discussions continue with the support of district council members and city leadership to prioritize efforts to reduce the community impact from the opioid epidemic. The Restore Kensington Action Plan does not represent MDO's full commitment to Kensington, Harrogate, and the surrounding communities. We fully acknowledge that there is much needed work to be done to truly restore and revitalize that community. And we have tasked the ORU with targeted, coordinated strategies to address the demand and supply side of this epidemic in partnership with community leaders. Now I'd like to kick it off to Noel Foysen, who's the director of ORU, who will provide an update and overview of the ORU response unit. Noel?
Sorry about that. I was on mute. Thank you, Tamar. Good afternoon, Chairperson Bass and other members of the Committee on Public Health and Human Services. I am Noel Foysen, Director of MDO's Opioid Response Unit. I am joined by Eva Gladstein, Deputy Managing Director, Health and Human Services. We will provide an overview of the Opioid Response Unit and status of opioid response efforts since the start of the COVID-19 pandemic. The Opioid Response Unit is focused on 12 strategic goals that can be grouped into 4 broad categories. 1, community impact and support. 2, prevention. 3, public safety. And 4, treatment. The strategic goals are further broken down into specific objectives that allow the city to monitor our efforts and attain our strategic goals by 2025. The Opioid Response Unit executive team meets bi-weekly to track those strategic objectives, monitor hotspot response, and adjust posture as needed. The Opioid Response Unit exec team includes leadership from MDO, Public Health, Department of Behavioral Health and Intellectual Disability Services, DBHIDS, Police, Office of Homeless Services, the School District of Philadelphia, and the Grants Office, with the District Attorney's Office, SEPTA, CLIP, Streets, 311, Parks and Recreation, Law Department, Prisons, Community Behavioral Health, Commerce, Philadelphia Fire Department, Planning, License and Inspection, and Town Watch Integrated Services supporting the 4 strategy groups. The Opioid Response Unit spent the first 6 months primarily focused on COVID-19 related impacts for individuals with opioid use disorder and the community impact. The Opioid Response Unit conducted bi-weekly virtual community engagement sessions during the spring and early summer with Kensington Area Civic and Community Development Corporation leadership to provide updates and address community concerns. Additionally, the Opioid Response Unit worked to create social distancing for individuals who are unsheltered by establishing a temporary drop-in center with 1 day at a time, ODAT, increased food access for all who are food insecure with Step Up to the Plate, connected individuals to stimulus resources, and expanded testing access in the community. The Opioid Response Unit recently regrouped and refocused strategic planning and response based on COVID-19 related impacts. The Opioid Response Unit will release a strategic plan in the first quarter of calendar year 2021. The following section highlights key updates as of December 10th, 2020 for response activities in Kensington, Harrogate, and surrounding communities. Eva Gladstein, Deputy Managing Director for Health and Human Services, will follow me and provide more detail on some of these items. The Opioid Response Unit Public Safety Strategy Group is co-led by the Police Department and MDO Criminal Justice. The group meets weekly with representation from the District Attorney's Office, Town Watch Integrated Services, SEPTA, and School District. The group has 3 strategy goals with the focus on improving coordinated narcotics enforcement, permanent closure of drug corners with community activation, and expansion of police-assisted diversion with co-responders. Public safety strategy strategic objectives to highlight are 1, implementing a revised narcotics enforcement strategy that will leverage officers that previously worked patrol in East Division to target mid-level operations. 2, coordinate narcotics enforcement activities with Police East Service Detail to disrupt drug supply, deter encampments, and decrease street homeless population. 3, implement place-based East Division narcotics enforcement strategy modeled on the successful KIP and Cambria operation to focus on the supply side of narcotics enforcement. 4, launch the Kensington mini station in January 2021 with 40 officers on foot and bike patrols to reduce violence and disrupt narcotics supply based on community policing model. 5, expand police-assisted diversion to the 25th and 26th police districts with additional corresponding team, weekend hours, and Salvation Army conducting active outreach for sex work and human trafficking. The next strategy group is the Community Impact and Support Strategy. The Community Impact and Support Strategy is led by MDO Health and Human Services with support from 311, Community Behavioral Health, CLIP, Commerce, DBHIDS, Homeless Services, Housing and Community Development, Law, LNI, MDO Community Services, Mayor's Commission on Aging, Parks and Recreation, Planning, and Public Health. The group has 4 strategy goals focused on activation of community spaces after narcotics operations, developing holistic trauma-informed programs to address community and generational trauma, expanding employment programs for at-risk youth and hotspot neighborhoods, and scaling affordable and permanent supportive housing. Community impact and support strategic objectives to highlight are 1, finalize city social service and operating department response package to support police narcotics enforcement activities to activate community spaces after removing drug dealing operations. 2, finalize procedures to implement tent and structure policy to provide standard enforcement guidance for encampments. 3, pilot encampment resolution team to target Kensington community hotspots and address resident and business concerns. 4, phase relocation of Prevention Point drop-in services and Point of Refuge to Beacon House with 60 low barrier beds on the Temple Episcopal campus. 5, expand mobile resources to support the newly launched public health funded Kensington-based cleanup program to focus on drug litter and human waste. Currently, the team is operating on foot, but will expand mobile resources by FY21 Q3 to allow for more coverage and rapid response. And 6, establish a temporary one-day-at-a-time drop-in center at Visitation for the winter through March 31st, 2021 to provide additional indoor social distancing and low-barrier housing. The third strategy group of the Opioid Response Unit is prevention. The prevention strategy is led by Public Health with support from DBHIDS, Fire, MDO Health and Human Services, Police, and Prisons. The group has 3 strategic goals focused on reducing overdoses and increasing harm reduction, expanding prescriber oversight targeting high-volume practices, and scaling alternative response units. The Health Department's Division of Substance Use Prevention and Harm Reduction permanently moved its field team to the Impact Services Building at 1952 East Allegheny to increase proximity and improve coordination between this team and the community most heavily hit by the opioid crisis. Prevention strategic objectives to highlight are 1, align ODSTAT, which is the city's overdose fatality review program, and opioid response unit to integrate overdose fatality review findings and recommendations with opioid response unit strategic objectives to improve service delivery across systems. Number 2, develop and implement culturally competent strategies to increase prevention and treatment messaging in communities of color in partnership with trusted sources such as community and faith-based leaders. The 4th strategy group is treatment. The treatment strategy group is led by DBHIDS with support from Community Behavioral Health, Public Health, Law, MDO Health and Human Services, and Prisons. The group has 3 strategic goals focused on expanding warm handoffs, expanding mobile medication-assisted treatment, and executing medication-first policies, provider incentives, and expanded access to treatment. Treatment strategic objectives to highlight are 1, formalize the seasonal pilot, which was called the Kensington Summer Strategy, into a year-round initiative, the Kensington Coordination Strategy. During the summer months, this effort led to 33 residential placements. Number 2, convene monthly Kensington mobile outreach and engagement meetings to increase data sharing and improve coordination and efficiency among multiple teams serving the community. And 3, expand 24/7 treatment capacity. We recognize that current conditions in Kensington are intolerable and community members feel left behind by city departments. The situation deteriorated during the COVID-19 pandemic, and incidents of narcotics-related gun violence are alarmingly high. Challenges for social service response have included additional COVID-19 financial resources for individuals with OUD being a barrier to engagement, decreased low barrier bed availability due to social distancing requirements, and suspension of indoor service delivery due to social distancing. Eva Gladstein will now provide an update on health and human services interventions in Kensington. I am also available to answer any questions.
Good afternoon. My name is Eva Gladstein, Deputy Managing Director for Health and Human Services. Thank you, Chairperson Bass and other members of the committee for the opportunity to testify today. I'm going to be providing some more detail on the materials that Tumar and Noel covered. I'm pleased first to report that the renovations of the building known as Beacon House on the Temple Hospital Episcopal campus will be completed in January, and Prevention Point will begin to move some of its services off of Kensington Avenue to that site at that time. That will include some of their drop-in services as well as the shelter services that are currently provided at the respite at 2917 Kensington Avenue. They will cease using the respite site no later than April 30th, 2021. In addition, Prevention Point will cease using the Navigation Center site located at 3247 Kensington Avenue no later than June 2021. Medical services and some drop-in services will remain at their current site in the church building, but as you can see, significant number of the services will move all that at that time. A significant program at the site, which is the Prevention Point Syringe Service Program, has been in operation since 1992 and at that site since 2008. They provided services to 13,500 unique individuals in the year ending June 30th. And there are 13 other medical, social service, and treatment services that are bundled in with that program, including HIV testing, care, preventive medical care, Hep C testing and treatment, overdose prevention, education, and Narcan distribution. It currently operates from the building 4 days a week, as well as from 8 mobile sites on a weekly basis, serving North, Northeast, Southwest, and Center City, Philadelphia. Presently, 76% of the syringes distributed citywide were distributed in Kensington, but many of the individuals who are coming to the building for those services do come from other neighborhoods. This presents an opportunity to provide syringe services in additional parts of the city through new mobile sites as well as brick and mortar sites to better reach those individuals and reduce the impact of the volume seen at the site in Kensington. And I'll deflect from my written testimony just to say that Chairperson Bass and Council Member Sanchez and Squilla mentioned this at the beginning of the hearing, that this is a citywide problem. And so we need to try to provide services or increase services throughout the city. I do want to note that the transition from the in-building site to sites in other communities will present some challenges. That will include Prevention Point has estimated the need for at least 5 additional sites across the city, purchasing vehicles and hiring of new staff. That could be a mix of brick and mortar sites as well as mobile sites. This will likely take 1 to 2 years to complete, and it would require political support, public support, and financial support. But it could involve moving up to actually over half of the individuals who are coming to the building for those services. The estimate is about 7,500 individuals who are might be able to move to other sites throughout the city. While it will take some time, we are beginning to propose additional mobile sites in the next few weeks or months to begin this process. And be able to reduce the number of syringes distributed in Kensington and complement the current services of the church. The Health and Human Services, through our health department and our Department of Behavioral Health and Intellectual Disability Services, are committed to helping support this work. And we'll be looking to council members for their support as well as we try to increase services in other neighborhoods. I also wanted to share some information around homeless outreach in Kensington. The Homeless Services Unit, as I think folks know, is funded and overseen by the Department of Behavioral Health and Intellectual Disability Services. They oversee an outreach coordination center, as well as a group of outreach teams that are provided by nonprofit service providers. They maintain a set schedule, providing engagement 7 days a week, 365 days a year, and 24 hours a day. They've operated continuously throughout stay-at-home orders and the pandemic. 5 of those teams serve Kensington: Project Home, Prevention Point, Horizon House, One Day at a Time, and a Special Initiatives team. Those teams have direct access to shelters, safe havens, recovery houses, and Journey of Hope, which is a residential treatment program. I wanted to point out that we provided, along with our written testimony, a set of materials developed by DBH-IDS that will give you, I think, clearer information than I might do through this narrative. And that information includes kind of a 2-page fact sheet on how homeless outreach works, with the phone number 215-232-1984, as well as information that I'll be sharing in a minute about hotspots with maps and some other materials. From March 1st through October 31st, there were 182 unduplicated placements from Kensington made through these services. And 93 of these were from the top 5 hotspots. I'm not going to read all the numbers, but just to indicate, and again, you have maps, that those hotspots that we identified were 2900 Kensington Avenue, 2700 Kensington Avenue, 2700 Tulip Street, 2900 Emerald Street, and 2000 East Somerset Street. The Kensington teams are focused there, but they also have their zones and they respond to other calls. In addition to daily outreach and engagement, the Kensington coordination strategy that Noelle referenced brings an interdisciplinary targeted response to the street, working to remove barriers to treatment and other services and meeting people where they're at, with multiple mobile outreach providers offering services, treatment, and shelter. This began during the summer as a weekly effort on Tuesdays, meeting on Tuesdays, to expand coordination. And it was so effective, including making 31 housing placements just during the summer months, that a decision was made to continue that throughout the year. It meets every Tuesday at 10 a.m. Right now, out of the PAD headquarters, the Police Assisted Diversion headquarters at F and Allegheny, and community members at 10 a.m. And community members are invited to join the huddle that begins that work every day and to provide feedback and assist in identifying locations that should be hit that day. In addition, there's a Kensington Mobile Outreach and Engagement meeting that operates on a monthly basis. This began this summer in July. And what that did is to coordinate across multiple outreach efforts. So we have the DBH-IDS homeless outreach teams who wear their orange vests and uniforms, but there are a number of other folks doing outreach in the community. That includes, again, the DBH-IDS Community Wellness and Engagement Unit, but also some of our other providers, Rock Ministries, Temple has a program, Drexel has a program, CBH member services are out there, our coordination with the fire department through the ARU2, Pathways to Housing, MAT, or Medication Assisted Treatment Induction through Prevention Point, the folks who are doing Police Assisted Diversion, the co-responder program, Meraki Mobile Outreach, and others. So, and now they've begun to work with the Salvation Army as well to coordinate the homeless outreach teams to help address the needs of folks who are engaging in sex work. So that's a monthly meeting across all of those providers, not just those who are funded directly or operate directly out of the coordination of DBH-IDS Homeless Outreach. And the data dashboard that Noelle referenced in her testimony will be an effort to take the data that we have now from those multiple sources to be able to cross-reference them and show them in one place at one time for us to be able to track our progress here. I also wanted to talk about the need for trash pickup and safe needle disposal, because these needs have certainly increased during the pandemic. In response, as we mentioned already, the Department of Public Health launched Clean Communities Initiative right before Thanksgiving. It's a team of 10 individuals that are working to complement other cleanup efforts. Certainly the community development corporations and CLIP have been very active doing this, as well as our same-day pay program. But we now have 10 additional individuals who pick up trash, discarded drug litter in affected neighborhoods, 12 to 5 p.m., 7 days a week. They're working with community organizations, the neighborhood associations, to identify the areas of greatest need. And I think Noelle mentioned working with CLIP with a hazmat team to clean up human waste as well. We've also done work in the last several months with our health department around Kensington meal providers, outdoor meal providers, because they are some of the major contributors to trash and litter in the neighborhood. And we're working to address those community concerns. And we have to thank community members for helping us think through some of what we're doing here. So we're focusing on permitting those providers and providing education to them on the community impacts from litter and trash that's left behind. Public Health is doing a sweep of those meal providers who are not permitted to ensure that by this month, they will all have permits, and that we're now requiring to get a permit that there be a plan for how they will remove litter from the community. I have a phone number in my testimony, so that if somebody witnesses that, they can make a phone call at 215-685-7495. And we'll continue to try to improve on this issue. We've also been asked to think about the impacts of donated goods beyond the outdoor meals that sometimes result in a lot of trash and litter in the community because they're often not well managed. And we believe that the identification of one or more sites that can be properly supervised and organized can reduce this. Currently, some of these donations are being made at the Ruth and Clearfield parking lot, where we're providing meals to Step Up to the Plate, and that's staffed and can be organized well. We also believe that once 2917 Kensington Avenue is vacated, it used to be a thrift store. I'm not sure what the landlord has in mind for that, but that or another location could be identified and frankly provide some neighborhood business and activity. And we're really happy to continue to work on the recommendations and provide input, get input from the community, but also talk to City Council about this, because right now we don't have any authority to regulate this, but we're happy to come up with some recommendations and best practices and provide advice on that. With that, I want to thank you for the opportunity to share this update. We are now available for questions, and as has been mentioned before, other members of the Health and Human Service agencies are available to assist with that. Before I finally end, I just do want to give a shout out to DBH-IDS for the materials they provided. I really want to encourage council members. I didn't give them their due in terms of going through them in great detail, but I want to just encourage everybody to review them. Thank you.
Well, thank you. We want to thank the administration for that significant, very comprehensive testimony. Do we have any questions from members of council? I think Councilman Squilla. The chair recognizes Councilman Squilla.
Thank you, Madam Chair, and thank you, Tamar Noel and Eva, for your testimonies as we've been working on this for a long time. A couple quick questions. One was that there were 13,000 individual touches at prevention point. Do you know if out of those 13,000 individual touches, are there multiple touches with the same individuals over that time frame?
Likely, I don't know the number, but the 13,000 plus are unduplicated. So many of them may be coming back multiple times.
All right, so do we have any statistics that show if they come back more than once?
I will ask for that, Councilman.
Okay, thank you. And you had said the distribution of at least prevention point, or I don't know if it's prevention point in some of the other providers for the syringes, was up at close to 76% in the Kensington area. Out of that 76%, I think the last time we spoke, it was maybe 86 or 90% was returned. Is that still the number that you're coming up with?
I received updated numbers because the last time we communicated about that, we hadn't accounted for that is the number that come back through the syringe exchange itself. Then there are other ways that syringes are collected, and we hadn't accounted for the other mechanisms through which syringes are collected. Again, I can provide you with some more detailed information. I don't have that right in front of me. It does mean, I don't want to shy away from this issue, that there are syringes that are distributed that remain on the street. We can all see that when we're in Kensington. So it's certainly nobody's claiming it's 100%. It is more than the number I had provided in our previous correspondence, only because we hadn't taken into account, for example, the needle kiosks and some of the other collection that is happening through the KIND program, for example, and now through the health department program.
Those needles are just selected, or I guess collected as the person who uses them puts them in, or are they collected by some other means? Do the user put them into these collection boxes? Is that what you're saying?
I'm sure users put them in the collection boxes, and I'm sure other folks do as well. Okay. So some needles are returned to prevention point directly through the syringe exchange program in the building or at one of the mobile sites. Some go into the needle collection boxes, and I'm sure the needle collection boxes are being used by a variety of people, not just the folks actually using the needles. Some are being picked up through the KIND program, operated by Impact Services, and some now are being cleaned up through the health department program that I just referenced.
Right. But they're being cleaned up as far as picked up off the street. Is that
yes.
Correct?
Correct.
All right, and we mentioned, and I want to thank sanitation and everybody else who's been working there, and the amount of resources we've spent cleaning up in and around that facility has been amazing with CLIP and sanitation. I'm glad to hear that you are now working with the people who have good hearts and are looking to help those folks out on the street, whether it's with food or donations, but we have seen that sometimes they do cause a little bit of the trash issue. So I'm glad to see that they will be permitting them, and we will have hopefully a list of people who will be distributing food, and then they will be accountable. Is there any type of accountability that will be given if they do not abide by the permit?
Yes, and Councilman, there's a monthly meeting of that the Health Department and the Office of Homeless Services hosts in Kensington, and I know community members are welcome and have attended in the past. And we created a calendar of those food providers who are permitted, and also the Health Department has a list of those who are providing meals who are not permitted, and that's where they're doing the sweeps right now. The Health Department is first going to give a warning, and after, if folks don't respond after the warning, what they can do is issue a ticket, or it's like a CVN. I'm not quite sure, what effect that will have. I think the warning actually will be have more effect than the ticket. So they are committed to doing that.
Listen, you don't want to punish those people who want to help. You should be able to use those folks to help in our areas where we have indoor feeding, volunteers, and organized events that we have in the city. I'm sure those folks would want to do it. Sometimes they just don't know what to do. So I think that leads us into that citywide policy that we've been talking about for years, to have not only an encampment policy citywide, but also how food would be distributed, how clothing is being distributed, instead of just dropping off boxes of bags of clothes on the street and everybody rips through them and leaves them all over the place. There has to be some organization of how we do that. So as we have requested the policy on encampments, I see there's going to be a policy on food distribution, but have we come up with a policy on how we deal with the encampment on private property and the right of way? Does anybody want to answer that?
I'll start, Councilman. I don't know if Tumar wants to join me. I just actually had a conversation with the law department about this earlier today. So on private property, the owner can work with the police department to indicate that it is essentially that they haven't given their permission and that it's trespassing, or they can file a civil action and basically get an order when the sheriff could help them enforce that. I know for private owners, that's probably not the answer they want, but that's right now what the law permits. Again, as I confirmed earlier today.
That sounds contradictory to what we have heard, that on a private property, it is the law, the current law, that you cannot encamp on private property. To have somebody go to a sheriff's department to evict somebody on their private property, does not make sense. I mean, if somebody is on your private property and we engage them with homeless services, if they don't want to leave, they have to be removed. That's the law. I mean, I don't know why they would have to go somewhere. You're putting this onto an individual private property owner to remove them. I don't think that's what we're looking to do.
Maybe I wasn't clear, Councilman. The first response was, if they contact the police department, they document that the person does not have permission, then the police department can assist them with the removal of the individuals. I will have to say, the police department is obviously doing a lot of other things. So I don't know what the timing of that would be, but that was the first option that's available as well.
And how about homeless services? Can homeless services inform the individuals that, we want to offer you assistance, we want to offer you help?
Oh, absolutely. Homeless outreach will go to inform the individuals, and will encourage them and connect them to services or shelter. And they often will do this on private property.
Yeah, but I mean, what we have been doing too on private property is if they don't want to go, we let them stay there. Is that something in this new policy that we will see written that will state that that's not the case?
I will have to go back to the policy to see what it's. I think it only is addressing public areas and not private areas right now.
All right, and so the public area, what is the policy for blocking the right of way?
Eva, is the policy, let me jump in a little. Is the policy for, and my apologies, Mark, because I'm not as well versed as Eva on this, on the directive or the policy yet. I think the policy for, and Eva, correct me if I'm wrong, I believe the policy for blocking the right of way is that we provide a certain amount of notice, and then after that notice has expired, we could then remove any blockages or any I'm gonna say tents or structures from blocking that right of way.
That's correct. And depending upon the amount of time the person or the structure has been there, then the amount of notice can be adjusted so that, so it can be, if we're actually observing the tent or the structure going up, it can be as little as taking action immediately. But if it's already up, depending on how long it's been there, as little as 24 hours notice.
Okay, and then from what we saw in some initial, I know we used to do the service days where we actually go there and engage the individual and give them a timeline. Seems like now the policy changed that where we clean up after them and give them some trash bags to keep it neat, but we let them stay there even if that is a problem or a blockage in the right of way. Is that true?
I can't state that that's correct. I know we're still doing the service days and the cleanups, and those have never been, we haven't posted those so that we're saying that they cannot return, so people do return. There may be incidents where that has occurred, Councilman, but I'm not aware.
Okay, I mean, we've been talking about this for a long time. I know at this hearing we were supposed to have that policy in place, and maybe I'm just ornery right now, but it's something that I think we expected to have because everybody needs the same information. Everybody needs, from the police to the residents to the homeless service people, everybody needs to know the same thing. And giving different people in different districts different information as they handle it differently, it does not work well citywide. And as we're doing this now, and I know we're focusing on Kensington, but we're having these encampments also, and whether it's opioid related or mental health related or just homeless related, they're popping up and growing more and more. And as we get colder into the winter months, we need to be able to have something in writing that we could all work with, whether it's with the city solicitor, and make sure that we're adhering to that and abiding by it so that everybody does the same thing. I wish we need to have something that you could share with this committee and maybe share it with the chair who could give it to us, that we could then at least go over and look at it and have questions with it and maybe massage it so that we could all be at the same place. It's unfortunate that we don't have that right now, but I'm hoping that we can have it very shortly.
Go ahead.
That's our intent, and we will provide that. And I also think it may be helpful to not only provide it, but then to set up a briefing for the committee to sort of walk you through it, then for us to be able to answer those questions in real time and be able to do that, be able to make that process a little more interactive than just sending you the document.
All right, I'll yield my further questions to Councilmember Sanchez or anybody else who has questions.
Thank you, Councilman. Chair recognizes Councilwoman Maria Quinones Sanchez.
Thank you. And I'm going to address some questions to Tumar first because I know he has to leave. So Tumar, can you outline for me, because I know we didn't talk about it a whole lot, but a little bit more around the public safety strategy increase. I think one of the things that in this presentation and more for the record is that, the police department did reconstitute its narcotics bureau, and that part of what we're talking about community policing is not going to be the piece that is as targeted as the narcotics piece that, with COVID had not been active there. I think that's an important part of this because everything we talk about human services is important, but people want to know how are we going to move away from the open air markets.
Thanks, Councilwoman. I'm actually going to defer to Deputy Commissioner Joel Dales. And just to let you know, Councilwoman, I resolved that conflict so I can stick around a little longer. But DC Dales, if you want to call DC Dales and his team, including Captain Rosario, the inspector, I believe we have the new chief inspector for narcotics and others on the call. DC Dales?
Yes, how are you? Good evening, Chairperson Bass and Council Member Quinones Sanchez. How are you? So you're referring to the community relations portion of it?
I want the narcotics one. I think part of the challenge for folks has always been understanding that without disclosing all of what you're going to do. But I think people need to know there's a new structure, new leadership, and there's going to be a focus.
Absolutely. So what I'll do, I'll let Chief Inspector Flacco, who oversees the Narcotics Bureau, you can chime in and explain your strategy and plans.
Good afternoon, Council Member Bass. Good afternoon, Council members. As I have discussed previously, I was given the opportunity to kind of reform the Narcotics Bureau as it relates to the East Division. I received 14 members from the East Division that are now detailed to the Narcotics Bureau. Those individuals will target organizations within the Narcotics Bureau. But Councilwoman Sanchez, as you and I talked the other day, the police department's only responsible for the enforcement of the narcotic laws. One of the problems that I see is once we make arrests, we kind of move away from that area and go after another group. And we don't do anything to hold the area where we just made those arrests. So as you well know, based on those discussions, once we make an arrest of a targeted area concerning a targeted group, that's when other agencies have to come in to hold that area, hold that land. And that's not something the police department can do, but working with the ORU and with Noel and your office, the goal is that we'll take block by block, organization by organization, and then prevent them from moving back into that area. So once we have enough evidence or once we have enough probable cause to take a particular organization down, working through our city partners, we'll let them know what we did, and then that's when the other city agencies are going to have to come in and do something about that. More so, it's not just attacking the street level drug sales. It's more than that. It's attacking the supply chain as well as the financial end of this. If we arrest somebody off the street for selling narcotics, that individual goes away, goes to jail, he's taken off the street, and all the drug dealers do is bring in another individual a couple hours early, give him some overtime to continue selling. What we want to do is we want to take the stash houses where you find the drugs, which are traditionally not in the same areas where the drugs are being sold. We want to get the stash houses for the United States currency, and we want to hurt drug dealers. And that's my job, and that's what I've been tasked with, to hurt drug dealers. And that's what I'm going to do. But I can't do it by myself, and that's where the other city agencies are going to get involved in helping us do that.
Thank you. That was an important piece, because folks will, and when you hear from the public testimony, I want to ensure folks that we're not doing the same thing as it relates to our public strategy. And we appreciate the compliment of the officers, the support for Captain Rosario, because the narcotics piece of this is not done by the patrol officers. That piece of it is to provide the daily public support by patrol officers through the bike and the walking folks. But I also want folks to know that the narcotic strategy will be different, will be targeted, as opposed to what has happened in the past. So thank you very much, Chief, and I look forward to continuing to work with you on that. So Eva, let me go to you. I know the issue of a policy versus enforcement is much more complicated as it relates to encampments and the tent structure. Give us a timeline of when you think you will have a clear cut what we're going to do. I want folks to know that when they call 311 or when they call homeless detail to report an encampment, what should they expect? What will they see as it relates to illegal encampments, restrictions on private property as well as public property?
So as we testified earlier, we're just finalizing some procedures, literally down to like who does what when, and to the point that was made by the councilman, so that there's real clarity with police, with homeless outreach and other folks. We expect this will be finalized in January. We'd also, I think, failed to mention that we are working to set up a new encampment resolution team, and expect that will be, available as of January as well. And they will complement the other actors who are already participate in doing this work and be an added resource. Again, to the point that was made earlier, this will be a citywide strategy, but for now we'll be piloting the encampment resolution team in the Kensington area.
Thank you. I also want to thank you for highlighting and acknowledging that we heard the community and that we're going to move some of the services that's created some of the challenges from the area. And I want to acknowledge Prevention Point and their leadership who are working with us about that. There's a recognition. This is not about people not having empathy for the work or understanding of the work. We are now past that argument. We are now in a Restore Kensington mode. And so I appreciate the fact that the Tumar, under your leadership with Noel and Eva and others, we're moving that. So we mentioned that we are going to close the thrift store respite center as of April 2021. Eva, could you say date certain for the Harrogate Respite Center? Do we have a date for that one?
We have the date of June 2021. I'm just not sure if it's the beginning of June or the end of June.
Okay, so that's important. The other issue, as we move to make this a citywide effort, the recognition that 76% of our needle exchange work is done in Kensington, where there's 13,500 unique service folks being served from all over the city. One of the challenging numbers that has been debated by the community, and you'll hear from them later, is the 5 million needle number. And I appreciate the fact that you recognize it's going to take a couple of years to move to mobile site. What is the administration prepared to say today that's going to happen in the next 6 months around the reduction of that needle exchange? The request by Councilmember Squilla and I that we want to see that number reduced by 50%. So tell me what is going to happen immediately, as that has been one of the most traumatizing data sets that has been shared with residents.
Yeah. I don't want to misspeak, and I don't have the exact information. From the conversations I've had with Prevention Point, I believe that they think that there are about 2 million of those needles, of the 5 million or close to 5 million, that can be removed from distribution in Kensington. I don't have the exact date. I would say 6 months is a good approximation, but I can't commit them to that right now. But they did believe that from that 4.8 of 4.9, about 2 million could be removed through some of their early work.
We will make sure that we have a hearing prior to the summer. I know a lot of work is going to be happening in the winter, and it's a different approach, but I want to assure people that the commitment by the administration, and again, this team that is on this call from the administration, is we will have a summer plan, and it will look different than it has the last 3 years. So I just want to be clear that we will have this conversation in March, and I want folks to be really certain about what they're going to see, what they should expect as it relates to the summer. I also want to thank you around the dashboard and around, the request for residents to be able to see, as real time as possible, who's in the neighborhood, identifying through uniform, who we're interfacing with, I think is going to add, to our attempt to restore the trust that we have lost from the residents of Kensington. I think that kind of information is going to be impactful in them seeing some of that transparency and some of the information. And I don't want to get into the nuances around the expansion of PAD, who's getting service, connectivity. I'm expecting that dashboard and the creation of that dashboard is really going to show us who we help, how many times it takes to help someone, and how we're interfacing with folks so that people know what is readily available. As it relates to the issue of the cleanup crew, I just want to be clear, that just started right before Thanksgiving, right?
Yes.
And so they will be out there 7 days a week. In addition to the permitting and the policy, can we get a commitment from the administration that we are going to limit distribution to certain locations? I understand these are well-intentioned folks, but there has to be a system about what we're permitting, and people just can't go where they want to go, right? I think part of what we have to move to is, as we have done with some success at Ruth and Clearfield, can we identify and limit those permits to 1 or 2 locations versus what we see now? I think all of you will agree that the encampment on the 3200 block of Kensington has created a daily distribution at Kensington Allegheny in a transportation center that impacts 20,000 people that have to move through there. So that has a direct impact on the daily commuting life of folks, let alone when the school starts and we have Sheridan and Elkins. Can we agree that that permitting cannot be open-ended and really has to be limited? And can we work with the community around those selected sites? Because that, and I talk to some of these folks, and I try to discourage them as much as possible, as the captains do. We need to limit it because they can't just pop up where they want. And they can't be in a transportation center where we have children and workers who are trying to commute daily. Tuna?
I know Eve was going to talk, but I just want to add, we can commit to working on that. One of my concerns is that, and I think it's a legal concern that we all need more advice on, is that when we were sued a few administrations, maybe last administration, by Chosen 300 in federal court, which allowed them the ability to be able to serve through these type activities in places, and we couldn't limit that. So I would want to get advice, legal advice from our law department and from others to tell us within legality, what can we do in terms of permits and those activities. Like Eva said, we can certainly chase some of these folks and understanding that they have the best intentions of heart. We can certainly chase some of these folks, give them warnings. We can certainly guide some of these folks to areas. I want to know, what can we legally enforce them to do as it relates to specific locations. I understand it's different. It may be different on private property than it is on public property, but I do think we need some guidance from law in regards to that lawsuit. And I understand once we lost that lawsuit, that was talking specifically about the Parkway, but I'm assuming, so I need the guidance to see if that applies citywide, which I'm assuming it does, and what authority we have to be able to tell folks, hey, you could do that in, area A, B, and C. Here are the areas that's off limits, and try to work with them. I think most times, like Councilman Squilla said, my apologies, that when you approach these folks and like Eva said, you give them a warning, their good intentions and be willing to work with us. I do think there are some that we have encountered. I think all of us on this call, and certainly the residents, who don't matter how many times we say, can we help you better with this? Can we even, can you give us an update? Say, hey, I'm going to be out here from these hours. Then we can coordinate trash pickup. There are some folks who will work with us. There are some folks who will not. I want to make sure that legally we are doing what we can do to sort of mandate and get to that point that you're talking about, Councilwoman.
For public safety, again, we have the health code issue. Right now, they are setting fires to keep warm at night. What other kinds of emergency triggers does that give us an authority to remove stuff? Because right now, as you all know, around the Walgreen and on the 3200 block of Kensington, they actively are lighting fires at night to keep warm, which could cause another problem because they're right in front of businesses. What, if anything, and guidance has been discussed around that?
I'm not sure if I've been in any of those conversations. I certainly can bring it up in this same conversation that we plan to have with law and with the new city solicitor Cortez.
Okay, thank you.
If I could just add a little bit, the federal court ruling was applicable throughout the city to all parkland. What the health department has done in the last month upon conversation is to require the permit to have a much more limited geographic area, because it used to be the permit would say, it could be a half mile here or there or a quarter mile, and now it's an intersection or a block, and the permit is only approved for that place. So that's one step we were able to take, and we would have to explore with Lord, as the managing director said, to see what more we could do.
Okay, well. appreciate the most, because it gives, direct impact, has been the police response to some of the issues, and then the trash and the Department of Trash. So if he could briefly come forward and speak to the level of volume that we've been seeing, because we have increased volume citywide because of the pandemic. I think no one has an idea of what the amount that has been in Kensington, some driven by some of the food distribution, some by obviously the folks with goodwill, but also people really being on lockdown in this community. And so thank you to DC Warren and CLIP members. We really, really do appreciate all these folks. And I really want to thank them personally in the way that they treat residents and respond to, those multiple calls that we have. DC Warren? You're muted.
Pardon me, I'm sorry. Can you hear me now?
Yes.
Can you hear me?
Yes.
Good afternoon, everyone. I'm Keith Warner, Deputy Commissioner of Streets for Sanitation Operations. I'd like to thank all the council members present and the Managing Director for inviting me to speak about the situation. For any of you who lived through the summer in Philadelphia, as Councilwoman stated, trash tonnages aided by the pandemic was severely increased in the city itself, and is exponentially in the opioid affected area. Just referring back to some of the stats that Noel gave earlier during the 3-week summer initiative, where we diverted a crew, one single crew, which is all we could actually spare because of the rest of the trash situation in the city. In that 3-week period, the crew collected 360.61 tons of trash in the opioid area. To put that in perspective, a normal week of trash collection in our heaviest neighborhood is about 420 tons. So in a 3-week period, in a very condensed area in Kensington and Harrogate, one crew collected over 360 tons of trash. In addition to that, in over a 6-week period, assisting with Noel and complaint-driven trash services based on the transient population in Kensington. My crews have serviced, I have a 13-man short dump crew, which is responsible for the whole city, but about 35% of our calls are down in Kensington. Over the last 6 weeks, we've serviced 25 complaint calls from the opioid response team, and that has netted, I want to get this number right, 1,093.89 tons of trash and debris. So the problem is as everyone has stated, is real, and if you combine normal trash collection with what's being added to by the opioid problem and compounded by the virus, the tonnages are just through the roof. I will call particular attention to the same block that the councilwoman just spoke about, the 3200 block of Kensington Avenue. We service that block every day at 7 o'clock in the morning. And I guarantee you by 9 o'clock in the morning, you can't tell that we've been through. And I can verify that you can't tell that we've been through by the amount of calls I get about it every day. So that's just an example. We are working very closely with Noel and the police and MDO and council on some strategies. But even if we service some of these places every day, with the community buy-in, the programs that are being fielded by the community, we need all our partners to help us to assist with these problems. And hopefully we can come up with a long-term solution to solve the issue. Council has been very supportive. I'd like to thank all the council members on board in this call. They've all been working very well with the sanitation department, providing us with resources and being patient and understanding that we can't just drop normal core services and run and address each and every complaint that we get, but we do try to make sure that we can accommodate the request of the people, because we do realize that and take care of the complaints as quickly as possible. Thank you.
Thank you, Commissioner Warren. And again, we will continue. We will work with you. Just want for the folks from the residents, we are working with the Department of Streets on a camera strategy, and both Councilman Scola and I are prepared to provide significant resources so that we can really tackle what have been the more egregious, daily dumping situations. As I tell everyone, we have had an hepatitis A challenge prior to the pandemic. We have a lot of human waste. And when we see trash, that means someone had to clean up to come outside their house. And I'm not going to ask people who have to clean human waste to come outside their house to then take that bag in their house. And so as ugly as it looks, after I've been cursed out several times by Black captains who do this daily, I think the city and the streets department, have worked with us. I'm just going to ask folks, particularly when they're taking out loads of trash because they're cleaning up, please call 311 and let us know so that we can better coordinate that. But I'm not going to ask anybody who has to clean human waste to come outside their house to take that bag back in their house. We just need to know about it so that we can help facilitate it. And that's part of the strategy around the localized dumpsters in the area that we'll be working towards. But I just want folks to know we hear you. We've listened, and we are not going to, we're going to be empathetic to the fact that if you cleaned up, so any bag that folks see, that means somebody took the time and cleaned up, we're going to pick it up. As my Block captains, I won't shout them out because they curse me out all the time. Say, I'm going to put it there and y'all going to come pick it up, Maria. And yes, we will. But we do that because of the coordination with the city and the department. So I thank you very much. Madam Chair, I want to, because we have started this hearing so very late, I want to give an opportunity to the community residents who have been so patient. They've been patient for 3 years, and now they've been patient for 4 hours, so that they can put their testimony on the record. Thank you to Umar, Noel, Eva, and all of the team for working through this Restore Kensington list. We got a lot of work to do. None of us are going anywhere, and we're committed, and we'll continue to hear the residents out. Thank you, Madam Chair.
You're very welcome. And I want to thank everyone from the administration for being here and for your testimony. Greatly appreciated. If we could have, Madam Clerk, if we could have you call panel number 3.
Sonia Bingham, Darlene Burton, Brooke Feldman, Alicia Crosby, and Shannon Farrell.
Okay, if we could have folks come in that order and state your name for the record in that order and proceed with your testimony. The first person was Sonia Bingham. Sonia, are you there?
Good evening. Yes. Hi, my name is Sonia Bingham. Sonia rhymes with Tanya. I am a new Harrogate resident. I moved here from East Kensington in June of 2019. I sold my house because my children are going to college and I don't want them to incur any college debt. I have never really ever actually lived in a community of color before. This is my first experience, and it has been a nightmare. It has been exhausting. It has been a real eye-opening experience for me. To see the disparity of resources, of common sense items that plague our community. A typical day for me is I get up in the morning, I go for my morning workout, walk, whatever, and then I come back. I get my rake, my broom, my shovel, my bag, and I get to work. And I go up and down Madison, I go across on Jasper. Just recently, I put my foot down. I'm no longer picking up feces, right? Like I'm just not doing that anymore. I've had it. And I look at I think what's most disappointing in this is what I'm starting to realize is that the narrative that I've heard all my life about Black lives don't matter, people of color, are given less resources and less consideration is actually true. We can take this whole situation back to 30 years ago when we had the crack epidemic. Our community was criminalized. We were thrown in jail because the white communities were being adversely affected by the crack epidemic. Now, in this community, you have the children and the grandchildren of the same crack criminals that were thrown in jail. And, I'm hearing somebody talking. And we're watching white.
Can I ask, I'm sorry, Sonia. And can I ask, if you are not Sonia, please mute your phone so that we can hear. There is some background noise. Thank you.
Thank you. And so we're watching now, once again, our lives not being prioritized. We're seeing now that the opioid crisis has changed color. It's now a white community, mainly from what I see living here. In my community, we now have to be understanding. We now have to be patient. We now have to watch as same issues, drug addiction is now all of a sudden miraculously, we need resources for these people. And I'm not saying don't supply resources. I'm not saying nobody should have food, they shouldn't have the help that they need, but it should not be my problem. I don't have a problem with drugs. I do more than my fair share of due diligence in being a person in my community that I embody, be the change that you want to see. And my resume is full of it. But what I'm seeing is that when we ask for simple things like, there's a hepatitis A breakout. I have not seen the street department clean my street except for one day when we had the protest. And it was like a miracle. It was like seeing a unicorn come down my street. And it's crazy because I've lived all over the city. When I first moved here from New York, I lived in Center City. Streets were cleaned. We never had this problem. I also have watched how we have all of these organizations that have all of these meetings. And to the credit of Liz Hurst and her team and Noelle, she invited us in to have some discussions about the trash that these meal engagement people, and just by us being able to have some input to give our perspective, we started to see a difference in that. So we have a lot of these organizations who, I might say, are not necessarily serving their own self-interest by creating resolution-driven initiatives. Management-driven issues are more what they're involved in because it would go against their self-interest to resolve it, right? If you are a prevention point and you need to give out needles and all these things, you would shut down if the opioid crisis was resolved. So we see a lot of these conversations happening, and the residents, there's a community of residents that live here, and we're not being brought to the table to be a part of the conversation. We don't want to keep anything from anybody, but we want our voices to be heard because we can help with some solutions and resolutions, as just proven with the trash and the clothing that I pick up every single day because somebody gave somebody a new jacket, and I can tell who's giving what because on any given day, it's either somebody got new underwear, somebody got new socks, somebody got jackets, somebody was giving out jeans. I know because I cleaned it up. And it's just, it shouldn't be this exhausting to live in the city. I watched how we had the encampment and the Ben Franklin Parkway. Within 6 months, it was resolved. And I've sat here listened for months. We had our first meeting with the multi-city agency. For months, we listened and waited and watched you strategize on how to resolve this. But miraculously, when an encampment was in a portion of the city where the demographic and the tax bracket was completely different, it was resolved. Yet, we're trying to figure out how to do things that are just common sense. People can't be on the street. They can't be on your property. They can't be. You have to move them along. If people get arrested, you see them shooting up drugs, you give them a stay order. They should not be allowed to keep coming back to the area in which the blight is continuing to be a problem for the residents. We want to know why we have the drug dealers. Well, if I'm Starbucks, I'm not going to open up my next location in a town of 100. I'm going to go to where there's a town of 10,000. You want to know why we have so many drug dealers? Because the drug addicts are allowed to live on our streets. That's why we have the open air market. I mean, some of these things are really not that difficult to, if we just think about it just from a purely topical point of view. We can't allow people to keep coming back. You will put you in a police diversion program. We can no longer come to this area. There are things that I believe are well intended that are coming here, but they're not for the residents. We are being overlooked, and quite frankly, we're tired of it. We don't want another prevention point. We don't want a safe house. We don't want any more services being brought to our community that don't directly benefit the residents. When was the last time there was a meeting about what can we do for the residents? Can we get them better lighting? Can we start to fix up the facades? What can we start to fix up their sidewalks? What can we do to try to make reparations for the years of neglect, for the years of non-oversight that has plagued this community? At some point, we have to start to begin to have those kinds of conversations, because we're watching our kids see that bad behavior is what gets the attention, not the people who are living here. It's very, very difficult for me to get services. If I didn't have contacts with people within the city, I wouldn't get some of the things that I have done. It should not be the exception. This should be available to everyone, and it's not. It's really just not. Part of the problem with the trash is as a direct result of people being allowed to live here. It is the OK Corral. It is why it is well known throughout the tri-state area, I might say, as just last witnessed by the last looting incident we had when we had the second bout of civil unrest. And you knew that our corridors were compromised and our resources were pulled from our community to go protect West Philly and Center City. And we were left with nothing. Our pharmacies were looted. We had seniors could not get their medication. We are continuously overlooked, left out of conversations. And I'm really, really, really disappointed and very much, I wanted to not believe a lot of the, Black Lives Don't Matter, but I'm seeing that there's a real valid argument in it. And I thank you for your time.
Well, I thank you for your time and for, really showing, exactly how you feel, letting us know exactly how you feel, and some of the challenges that you've been through. Do we have any questions from members of council? No? Okay, so we'll go to our next speaker. Thank you very much, Ms. Bingham. Our next speaker is Darlene Burton. Ms. Burton, are you here? Darlene Burton? If not, okay, we'll move on. If she comes on, we will come back. We'll circle back to her. Ms. Brooke Feldman?
Hello.
Brooke, are you here? Okay, hello, Brooke.
I am here. Hello.
Hello, how are you?
I'm good. Thank you for sticking with us today.
Absolutely. Please state your name for the record and begin your testimony.
Sure. My name is Brooke Feldman. I want to thank you for the opportunity to testify today. I want to check to see if you're hearing an echo, because I hear an echo on myself. Let me take it out. Does this sound better?
I hear an echo.
All right, thank you.
Sanchez nodding, so, okay.
Yeah, I'll take the nod. So thank you so much for the opportunity to testify today. And I know that everyone had a long day, and it's extremely meaningful that you all are sticking with, having this hearing, even, after hours. I submitted my written testimony, and I just want to kind of focus on, there was 2 recommendations that were in my written testimony. One is that we have a tremendous opportunity with the opening of the commissioner position for the Department of Behavioral Health and Intellectual Disability Services to really look at the leadership. I appreciate the hard work of all of our city officials, but I can tell you as someone who has attended a number of these hearings, this isn't my first time testifying in front of this committee. I listen in and I attend these hearings religiously, and I appreciate the hard work that is being done, but I think the evidence is in front of us that what has been happening isn't working, and I appreciate Councilmember Kiona Sanchez mentioning that whole insanity, repeating the same thing, expecting different results. I don't know if she read my testimony and stole that line, but that's what it feels like. It really does feel like that we're repeating the same thing and expecting different results. And it's, consistently these special initiatives and a pilot program and having a steering committee with the same people discussing the same things and expected to come up with different solutions. And for those of us who are out here, both for folks like Sonia, who I've, come to love and appreciate, who's fighting for her community, and then for folks like me who, is really focused on fighting for people who are struggling with homelessness and mental health challenges and substance use disorders. I think for all of us, we look around and we just see that it's not working and it's time for something different. And so the one recommendation in my testimony is that we see the opportunity for new leadership, just like we saw the opportunity when the Philadelphia Police Department commissioner position opened up. And there was an opportunity for stakeholder input, stakeholder involvement, and just hearing that the community, recognizing the community has a voice and who is serving them in these leadership positions. But the second recommendation is really what I want to focus on. And that is, I think over the past few years, besides learning how, the dog and pony show plays out on these hearings sometimes, what I learned is even more important is that when we stop and listen to each other, we actually can come up with more solutions than when we're stuck fighting with each other. And I think for years, it was harm reduction advocates versus residents, right? And it was like, if you were someone who was fighting for the people who are struggling with homelessness and addiction, it was easy to be dismissed as someone who didn't care about the community resident concerns. And then vice versa. I know that residents were told if they didn't support Safe House or they didn't support Prevention Point, or they were saying things like, we want this out of our community, they were dismissed as not caring about people who struggle with addiction or homelessness. And for me, when I sat down and kind of shut up for a minute and listened to folks like Sonia, like Shannon, like other residents, like the councilwoman, what I realized is that we agree on far more than we disagree on. And that it's not that people who are focused on those struggling with addiction don't care about the impact on residents. And it's not that residents don't care about, the struggles people experiencing homelessness and addiction go through, and that we actually agree on more than we disagree on. And so the second recommendation in my testimony was to really have, let me actually read it because I think I wrote it better than I'll say it, an organized, ongoing, meaningful convening of Kensington residents, civic association leaders, people who use drugs and those who work with them, harm reduction advocates, anti-homelessness advocates, and treatment and homeless service providers, along with city officials and elected officials, to really go through the struggle. In my time working for one of our bureaucracies in this city, I worked under Roland Lamb, and he used to always say the struggle continues, but the victory is certain. And for the first couple of years, I didn't know what the hell he was talking about. And it took a little while for me to understand that we have to struggle through some things in order to get to the other side and to get to the solutions. And for me, the most meaningful, I think, endeavor that I've experienced over the past couple of years, and when I have the most hope, I can tell you, is not sitting on these hearings, hearing the updates of all the amazing things that are being done, because my friends are still out there dying, and I still get calls from Sonia about trash on K&A, right? The most meaningful sort of moments of progress for me have been in having these conversations of struggle and realizing that we agree on so much and that we work together, we're going to get somewhere, but we need support in having an organized way of doing that. And so that's my big ask, is that we have some way of bringing together community folks, harm reduction folks, city officials, and that, instead of people sitting in buildings or I guess now on Zoom calls and coming up with solutions, that we engage everybody who's out here living it and saying it. And some of the things that I know that we can agree on, because I've had these conversations, are sanction encampment. That was something that was promised back in July or August, and there's been no movement that I've seen on that. And in a location that works for residents and for people who use drugs and for those of us who work with them. I don't think it is an unreasonable idea that we can come together, have some difficult conversation, use language that maybe one or the other doesn't like, but come up with a location that works for everybody. Also, getting rid of the city's tone-deaf smoking policy. There are people who would leave the streets of Kensington today if they could go into inpatient addiction treatment and not be told that they cannot go outside to smoke a cigarette. I am all for people quitting smoking. I know most of you on this meeting have heard me talk about this. I want people to quit smoking, but when we have people who are injecting fentanyl who say, I want to go into treatment, but I won't because I can't go outside to smoke, that's another person who's littering, whose needles are on the ground, who is still experiencing homelessness in Kensington and who's contributing to the problem. And so getting rid of that policy is something that people from all sides of the argument seem to agree on, but yet we still have this policy. And I want to say for the record that there are many of us who would identify as harm reduction advocates who are heartbroken over the conditions that kids living in Kensington have to live with. I heard a story of there being a shooting and a body laying on the ground on Emerald Street and little kids walking by and stopping and seeing that body on the street. And I can't even imagine my 9-year-old seeing a body laying on the street and how that would impact their entire life. And that is normal, and that shouldn't be normal. And so I care about that, and I know many of my comrades in harm reduction care about that. And the last thing, and then I'll stop because I get cut off constantly when I am at these hearings, revolutionizing our treatment system. There is nothing that is more frustrating as somebody who still goes to funerals for people who are dying that don't need to die than hearing all these amazing things about our behavioral health system, yet every single day seeing the barriers that people face when they're trying to get help. This idea that people want to be stuck in homelessness and they want to be stuck struggling with addiction and that they want to be stuck being sort of a nuisance to a community is a lie. Most people do not want to be living in the conditions they're living in. And every day there are people who are trying to get help who face all kinds of barriers along the way. And I know firsthand that it often takes like a call, like a pulled string or a called in favor, someone calling their council member, someone who knows how to navigate the system to get somebody into treatment. And it shouldn't be that way. If it was easier to access treatment and remain in treatment and remain in housing resources that work for people, then we would have less of a problem that we have today. And so we really need to revolutionize our treatment system, move away from these little projects and special initiatives and pilots and whatever words we use, because it's not working for a lot of people. Thank you so much for the opportunity to testify.
Well, thank you so much for your testimony. And as always, you're always a wealth of information. And you're not in the 8th district, but I know that you're always out and advocating on behalf of the community. Even when you're beating us up, we still appreciate you. we know you're working hard. We know you're working hard, Brooke.
And Councilmember Bass, if I could tell you, I wrote this down as a note. When you reference that book, if only, even if your heart will listen, what you read in that book, and I wish every council member and especially the Health and Human Services folks on this call, read that book. It paints the status quo picture of somebody to access treatment that works for them. And Elise Schiller's daughter didn't have to die. And that's a story not about opioids. And please, can we stop just talking about opioids, please?
Yes.
But it tells you the story of how difficult it is for someone to get help who's looking for it. Yes. And that is an indictment on Philadelphia's behavioral health system that I love and I believe in and know that could do better. But that book is that'll tell you what people are experiencing right now in your districts and across the city.
I could not agree with you more. That book was really, there's very few books that I would say call game changers or life changers for me, but I would say that was one of them. It was really, really well written and just, you felt like it was happening right in front of your very eyes. It was an excellent read, and I do highly recommend it to the committee. I do believe that the author did provide copies to members of the Health and Human Services Committee. But if not, I'm certainly more than willing to share my copy if anyone would like to read it, because it's just such a compelling story. And I think it really does shed new light and insight into a struggle that we're all trying to figure out what to do. We may have different thoughts and ideas and suggestions, but we all want to solve this very, very serious problem. Councilwoman Sanchez, did you have a statement? I thought I saw you. Okay, no?
No,
All right.
I'll do the rest of the panel. We have some folks.
Okay, very good, very good. Okay, so next up was Luis Ramon Soto.
He's not coming, and neither is Alicia Crosby because of obviously our delay. I believe Sharon Farrell is waiting.
Okay, so we may have lost them. Okay, well, let's bring up Shannon Farrell, if you are here.
I'm here.
Hi, Shannon. Can you please state your name for the record and then begin with your testimony?
Sure. My name is Shannon Farrell, and I am the president of the Harrogate Civic Association. Thank you today for giving us this opportunity to come and speak with everybody and listen to what the managing director's office and everybody had to say about what we're going to be doing moving forward. And so I had a lot written down, and I don't know that that is going to be relevant after listening to the plans. But what I do think is I'm going to follow up an awful lot with what Brooke said. But first, I want to say that, our children in our community on a daily basis have to walk down the street avoiding human waste, use needles, dodging bullets, and watching for aggressive dealers on their corners just to walk to a friend's house, a corner store, and when school's open to school. Sometimes they could make a 3-block walk straight from their house to school, and they go out of their way to avoid areas and make it a much longer walk on Ontario Street to go to Webster. And so that's what I always speak about, and that's what always is my focus is our children. And recently we had an 8-year-old little girl shot getting off the LF station in K&A. And that's there's no words to describe that anymore. Saying that it's frustrating, heartbreaking. There's just no words for that. That's everything. That feeling to know that a child was getting off the L to go home and got shot. And that's what it has come down to. And I've met with the city for 3.5 years now with Tumar and Eva and Noel. And as individuals, I think they do care about the community. Tumar and Noel, especially, I work very closely with. And they've done a lot for the community. It's almost like Sonia said that, you can connect them and ask them, we have tires that be picked up. There's trash on this corner where this house has to be sealed up. And it's very quick to happen in that manner and in that fashion. But the plan, again, doesn't address the fact that we are still going to leave hundreds of people on the street and we're going to constantly have to be cleaning up after them. We have done meeting them where they're at, and it hasn't worked. We promised the community we were going to be patient, we're going to meet them where they're at, we're going to support a lot of things that isn't going to be for us, but for them, because we need them to get help and go into housing, go into rehabs, go into anything to get them off of the street. And it hasn't worked. And even when you get more off the street, more come, because there's just such a draw here with the drugs. And people come here for the drugs. Drug dealers from other areas now come here to deal drugs, and that causes violence as well. We have, our police department has been really great and fantastic. We've literally called them for, fear of our lives. And I watched their hands be tied by what the city worries about lawsuits, how they've been sued, worrying about confrontations with users and their advocates, telling us you can't arrest your way out of this, but we haven't figured out a way out of this. So to follow up on what Brooke said, and this is something that I can't speak for other people, but I've spoken to other individuals in the community about this who attend these meetings with me. And I know that it's not popular with council members that I spoke to about it, but I agree with Brooke, and I think that it's time that we move forward with the sanction encampment somewhere away from residents. Otherwise, this is never going to end. This is never going to end. And I was one of the people who came to you when the tunnels were filled and said we have to move these tunnels and these people out of the tunnels. Because the residents had to be able to access it. And the people that lived right by the tunnels, it was horrible conditions for them to be living in. But the positives of that was that everybody was located in one place and our neighborhood wasn't as trashed as it is now because everybody was going to one place to meet them where they were at. The problem is where they're at now is spread through the neighborhood and you can't always locate them. And there's just too many spaces and it's just uncontrollable and it's overwhelming. And it's unfair to us. It's unfair to our police department. We're all overwhelmed. We're all traumatized And I think that it would be easier to have more. I think there was more success with getting people from the tunnel to get into services. I remember the city telling me that you had a really good ratio of people that were coming out and accepting services. And well, they're not accepting services as often on the street. I do think that you don't put enough effort into it. I never run into outreach from the city. The only people actually I ever see on the avenue are people who work for a prevention point. I don't know why we don't have tent set up places doing it. When we were emptying out the tunnels, it was like a bizarre. I couldn't walk a block without running into a team of people that were out there and too engaged. And now I could walk all over the neighborhood days in a row and not run into anybody. So their service has been very much decreased. I think about the fact that we talk about housing, and I think about the fact that when I read an article in the Ben Franklin Parkway was being cleared out, I read a story about a couple that only lived in Philly for a year. We're getting a house, but I watched some residents live in my community and on my street, and they've never been given a house. I just read an article about the Holiday Inn, and that everybody's been at the Holiday Inn is being offered housing. And yet when we talk about housing for my neighborhood, I'm constantly told that there's just not enough housing. And I don't hear too many people turning it down, and I don't think they'll all accept it. I know they won't, but I think that it would be better served if you had started these things here and done more of that here. I just don't think that the effort that's been put into other places is being put here. I support a 50% decrease with prevention point. I don't want them in my neighborhood anymore. I think I've made that more than clear. 4.7 million needles dropped in my neighborhood, and no matter what number the city has come back with how they've come in, whether it's been through the KIND team, return to prevention point, the red boxes, that's leaves hundreds of thousands of needles on our streets. And that's unacceptable. That's unfair to us. We've lived through the drug epidemic, the hep A breakout, violence epidemic, overdose epidemic, and now the pandemic. Our children, my 7-year-old doesn't know life not to be like this. He doesn't remember not living like this. And for the people that want to constantly say, well, that's Kensington and Harrogate, and they've always been like that. I'm 43 years old and I've lived here my entire life. And I never had to dodge a bullet when I was a kid. I didn't have to dodge a bullet until a few years ago. I didn't have to walk over human waste. People didn't take over our neighborhood. This didn't happen. It was not like this. It's never been like this. This is unacceptable. And then when I hear people say that, I think they're making an excuse to not do anything about the issue. I've heard it from some people in the administration. I've heard the district attorney say it over and over, and I don't like that. And I met with all of you about this. And I feel like there are people in this administration that want to do this, but I feel like also you work separately, you have different theories. And no matter what it is, in the end, if we don't have a way to help the people who are suffering with addiction and homelessness in my community and have a place for them to go, like a sanctioned encampment, we're going to have this conversation every time because there's nothing we can do about the fact that they're not willing to go in and get help yet. And I also want to say that when I've met with the city in the past and discussed the homeless users, they've always been quick to say, Shannon, remember, homelessness isn't a crime and they're human beings. And then when I tell them that the same human beings tell me that they cannot get help at the net because once they detect a mental health issue, they're booted to the street. They're afraid to go into shelters because they feel that they're violent, just from the very people who they spend their time with on the street. They rob one another and beat one another up as well. They say, no, that we don't find that to be true. They tell stories, so when I have an issue with the fact that they're robbing us, living on our street and buying drugs from violent drug dealers, I'm reminded they're human beings. But when I tell the city that they're complaining about their services, the city then calls them liars. So I think that this is very frustrating for me. This is hard to live with and constantly sit in meetings and listen. And no matter what the end result, no matter what it is, the plans are always the same. And we're relying on people who are not ready to get help, that have mental health issues, to accept help and get off the street, and they're not ready. And so we've been doing this for 3.5 years since I've been meeting with you. And that's just not happening. So we need another solution, and we need our community to be safe again, and we need our kids to be able to use their playground. We need our kids to be able to go to their library. We need our kids to be able to go to school and feel safe. They can't use their playgrounds. They can't walk to school safely. They even go into the schoolyards and leave needles and human waste behind. And any plan that doesn't include moving this population to a sanctioned encampment or into housing with a good, solid plan, not a we hope this works, then that we're going to be doing the same thing over and over. Like Brooke said, this is the definition of sanity is what we're continuing to do. No matter what good intentions there are and good efforts that we're putting in, it hasn't worked, it's not working, and now the violence is out of control. And the other thing I want to point out is, and I love Brooke dearly, and we've been meeting a lot lately, is that one of the other things that's very frustrating to us is that you listen to an awful lot of people who don't live here that tell you what they think our neighborhood needs as if we're idiots. And none of that ever includes moving and helping and pushing for more rehab and people to the focus to remove them from the street. It's always, let's build, we have mural arts here. Let's have a storefront, have them come in and do all these wonderful things. That's great. But that's not what this community needs. We don't want that. We want a storefront with a store in it that we can go in and purchase things. Maybe we want a yoga studio. Maybe we want the pretzel factory that was going to open up in Kensington to open, but it didn't because of the conditions of the avenue. We know what our community needs. And right now, our community needs to be free of this. Our kids have to recover. We want them to grow up and we want them to be successful. And we're setting them up for failure. So I want to thank you for the opportunity to say this all today. I know many of you have heard it over and over before. And I do want to thank everybody for all the efforts that they have done to this part. And the streets department and CLIP are amazing. I want to say that. They are amazing. And so is a lot of the people that work in NDO's office too as well. And our police department is forever. I'm always going to be grateful to them because they are always in our corner and fairly too. They're very fair about how they handle the situations. So I want to thank you all.
Well, Shannon, I want to thank you for always being an advocate for the community. And I can tell you that we hear you. And I agree with you that any ideas, suggestions, input in terms of what the community wants should come from the community. I think sometimes people have good intentions, but if you don't live there, then you really should, focus on the community in which you live in and allow the people who live in Harrogate and other neighborhoods to be able to say what it is that is important to them because they are the main beneficiary of any changes, improvements, or a lack thereof. So I thank you for being on the call. Do we have any questions from members of council? And if not, we're going to move to our next panel. Madam Clerk, can we have you call panel 2?
I think Councilman Squilla is talking.
Oh, I'm sorry. Councilman Squilla?
Yeah. Can you hear me?
I can barely hear you, but I hear you.
Hold on.
Can you speak? Is it possible to speak up a little bit or?
Do I sound any better?
That's much better. That's much better. Chair recognizes, there it is. There you are. We hear you loud and clear now. Chair recognizes Councilman Squilla.
Thank you. I had AirPods in, so I guess that wasn't sounding too good. But I just want to thank the community members who are testifying. I know Brooke, and Shannon, and Sonia, how much time they have given to the community. And so they know exactly what they're dealing with. And even though not everybody has the same idea of how to deal with it, they know that doing the same thing over and over again is insanity. And they know that what we're doing right now is a failed experiment in that area. And so we need to make changes. We need to make positive changes. And we need to be able to listen to the folks who are living there day in and day out. And, a lot of times we listen to experts and to people who tell us what we should be doing. But when you're in the field and you're looking at it and working with it day in and day out, you get a sort of different perspective of how to deal with this problem. And if we're just going to just clean up after the mess every day, and we are doing that right now, and the resources that we're spending to do that is amazingly high, we're not fixing the problem. So until we fix the problem, until we come up with a plan, and I don't mind changing ideas and changing plans to come up with ideas to try to work through this. But until we do that, we're going to just spend dollar after dollar on cleaning up after it and not help anybody in the process. So I want to thank them for their testimony, and we'll continue to work with those folks in the community, as Councilman Sanchez has stated. And I know we have a lot of people to testify, so I'm not going to ask any questions unless something dramatic happens. So thank you.
Thank you, Councilman. Thank you for your advocacy. And so now we're going to ask Madam Clerk, if you could call panel 2 forward.
Casey O'Donnell, President and CEO of Impact Services. Maria Gonzalez, President and CEO of ASE. And Susan Post, Executive Director of Esperanza Health Center.
Wonderful, thank you. And Casey O'Donnell, if we could have you start first. Are you on the line, Casey?
I am. Can you hear me?
Yes, we can hear you well. If you could state your name for the record and proceed with your testimony, that would be great.
Sure, thank you. Casey O'Donnell, President and CEO of Impact Services. Prior to neighbors testifying, I had to go on another Zoom briefly, so if any of this is redundant, I apologize. You know, I've been doing this work at KNA and throughout Kensington for the last 7 years, and I didn't think that it could go any further down. And lately, I can say I'm hoping this is bottom, and the only place to go is up. And so I am hopeful. I have spoken with the councilwoman multiple times over the last few weeks, planning and trying to understand where we're headed as a neighborhood and a city. And I'm hopeful that all of the resources that have been brought in to clean are making a difference. KNA was actually clean today, and I was surprised. We have guys working over the weekend cleaning. You know, we're still trying to figure out how to tackle McPherson Square and some of the other rougher spots. I am hopeful about the police station. I am hopeful about changes to access to treatment. But honestly, I am most hopeful about trying to understand what is acceptable in public space. I don't know how many people on this Zoom call feel safe every day, but I can tell you that the basic social contract in Philadelphia has deteriorated to the point where only a select group of neighborhoods feel the basic protections that every Philadelphian deserves. The idea of trauma and stress only affecting a portion of our population on a day-to-day basis is unacceptable, inequitable, and actually despicable. Every Philadelphian deserves physical safety, emotional safety, and moral safety. And this idea of moral safety is our living up to our agreements. And frankly, that's where we have failed. If we want to bring safety to this neighborhood, the families and the kids that live there, we absolutely have to decide what is acceptable in public space. And that safety can also be afforded to the people who use drugs. And that means finding a sanctuary space for them to go so they can receive the services they need, and so that public space is free of feces, exposure to violence, exposure to, you know, all of the challenges we've heard. And I will say that when I was cleaning up McPherson a couple weeks ago, while the park was full of trash, the trash cans were actually empty. So residents have brought trash cans out to McPherson with the hope that people will use them, and the trash cans were empty. And so this isn't just about more receptacles, which I think is important, but this is about taking responsibility for public space. And again, I hope this is bottom, and I hope we can all remain hopeful. And I want everyone who has not spent time at Kensington and Clearfield to come by and walk around and see if you feel safe. I don't bring my son there anymore for cleanups because it's simply not safe, and I'm not going to expose him to it. And that is such a privilege and a choice for me and my family. And we need to afford that to everybody in the neighborhood. So if you have not come and spent a day and walked around the block and felt like you weren't in danger, you need to come do that because it'll hit home. Thank you for the opportunity to provide testimony.
And I want to thank you for your very insightful testimony. Thank you for being with us, Mr. O'Donnell. Our next speaker, Maria Gonzalez. Maria, are you here?
Yes, I am. Can you hear me?
I can hear you well. Please state your name for the record and then begin your testimony.
Yes, hello, good evening. My name is Maria Gonzalez. I'm president of ASE. Thank you for Councilwoman for the opportunity and council members to speak today. At ASE, we're very grateful for all the investments that have been made in the cleanup of the Conrail line in 2017. that addressed the encampments that had been there for over 30 years. That has brought a big relief to our community in being able to have some safety, at least around the Conrail Viaduct. And we have been working with Impact and our other partners to make sure that that area remains clean. Now, while that has been a positive, we still have the negative in where our community still is not our own. We're still dealing with issues of safety, as it has been said here before. Needles in our playgrounds and in our open recreational areas. And our seniors feeling unsafe in our community where they don't feel, just safe going out their door to go to shop or even to go to the corner bodega because they feel that they're going to be accosted. And it has happened on many occasions. And it's sad that we have to actually create fences to make sure that we keep our seniors safe. And that shouldn't be the case. I have been a big advocate with many of our partners to be initially to provide supports to the persons that have been suffering from addiction because they're very vulnerable. And I understand that. And it's really, a tough situation where folks are suffering from this illness in addiction. But I think now what we've seen is that equation is very one-sided, where there's a lot of supports and investments to help those folks, and our communities are suffering. And mind you, we have a very poor community that is suffering through high unemployment. And now with everything that's happening with the pandemic and the looting that happened as a result of the social unrest has really set us back decades where, many of our businesses are still shuttered, which means that we have higher unemployment in our neighborhoods. It makes it tougher to bring investments into the neighborhood after, this is over. Hopefully 2021 will be a much better year because we have to convince people that it is safe and it is, this neighborhood is worth investing and our residents are worth investing in. So, while we are looking at one side of the equation, we're still forgetting the other. And we have our neighbors feel trapped. And they need supports just like any other communities. They want to do good for their families. They want a good, decent job. They want safe streets. They want beautiful open spaces for their children, and they want a good education. So I think that there has to be more investments to this side of the equation where we're really looking at our families as also being victimized as well. And I don't like to use that label, but yes, they have been victimized, and we're not really focusing on them and their needs and their families. So I think as we're looking at strategies, we really need to consider the needs of our long-term residents and how can we bring additional investments for them to be able to do better and their children do better and they can feel safe in our neighborhood and we can have additional investments in our community. Thank you.
Thank you so much for your testimony, and I don't see any questions from members of council. And so our next speaker called by the clerk was Susan Post. Is Susan available? Susan, are you still with us?
Yes, I'm still with us.
Wonderful, wonderful. Susan, please state your name for the record and proceed with your testimony.
Yes. Hi, I'm Susan Post, the Executive Director of Esperanza Health Center. And I'm thankful and grateful to be able to speak to you today regarding our community. For some of you council people that may not be familiar with Esperanza, we're a bilingual faith-based health center that serves in North Philadelphia. We're trying to provide high quality, affordable, comprehensive primary care and also community health services. We came into Kensington about 12 years ago in a leased area, a leased spot on Kensington Avenue. And in these years, we've become more committed and dedicated to trying to engage the whole community in health services. And last year, we were able to open up a new state-of-the-art health center on the corner of K&A. And we've been able to expand our medical staff to be able to serve more people. So we're committed for the long run, long term, we hope, to be walking alongside you all as we try to make improvements in our community in the years to come. We know that the opioid situation is killing our community, and there's many people that are in need of health care, both those who are suffering from the addiction and the community residents who experience trauma and all the healthcare risks that come to everyone with the state of our community right now. We were grateful for the city's 2018 resilience project, and we appreciated that it involved a community-driven public strategy to address the opioid crisis. It gave me hope for what's possible with a real strategic investment of resources by the city, and also taking into account other agencies and our neighbors. But since the conclusion of that first resilience project, I just feel really like, and with COVID-19 beginning, I feel like there just really hasn't been enough effort or strategy to actually push back against all that's happening. And I think the effects have been really damaging for our community. I don't think there's enough being done to limit open air drug use and dealing. It's rampant, as our neighbors have mentioned. Esperanza frequently responds to overdoses, sometimes multiple times in a day, on the sidewalk right outside our clinic. The number of people living on the sidewalks of Kensington continues to grow. The lack of sanitation is overwhelming. We need to do more, and we need to do it collaboratively, and that's going to be vital to the health of the entire city, not just Kensington. So I applaud the Restorative Investment Plan efforts that we have, and I've just heard about for Kensington. I still feel overwhelmed, and I really don't know if what is all been stated is going to truly be enough. But on behalf of Esperanza, we're happy that the city is trying to address both the residents and those who are suffering from opioid use disorder. And in light of your goals, I want to ask that you would consider these priorities from the health care standpoint. Increase the city's capacity for inpatient rehab opportunities for opioid use disorder patients. Number two, find creative solutions for sheltering individuals that are still using substances, as homelessness is a massive barrier to the recovery. Three, I know that this is happening, but I think it has to happen more, is to deploy the additional outreach workers to serve as bridges to rehab, to getting to emergency shelters and other linkages. In my estimation, I think this would go a long way, and maybe even further than the increasing of police presence. And then lastly, just improving the sanitary conditions throughout the entire community, which has been stated several times already. I think more can be done to increase access to safe needle disposal. And I think more public restrooms would really be important. I don't want us to overlook the tremendous assets of Kensington upon which our city can build. My colleagues that just spoke, the residents who spoke, while they're rightfully angry, they are engaged. And there are many churches, agencies, and people, and Esperanza Health Center who want to add to the solution. But we need the city to engage more. And with this resolution, we ask the city to invest, take immediate action, and consider long-term strategies to ensure that Kensington is safe and healthy for all who live in it and all who enter into this community. Thank you very much for taking my testimony.
Thank you very much for your patience and for being here with us today and that very important testimony. I don't see any requests for statements or questions from the panel from my colleagues, but I do see that Councilwoman Sanchez would like to make a closing statement, and anyone else from the committee who'd like to make a closing statement, please just let us know by raising your hand or going into the chat. Chair recognizes Councilwoman Maria Quinones Sanchez.
Thank you, Madam Chair. I want to, again, grateful to this committee. As you know, I chaired this I was vice chair of this committee for many years with you. And while I don't serve on this committee, I appreciate the fact that this committee has been instrumental in documenting the work that has gone on in Kensington. And I want to end where Susan spoke to. One of the biggest challenges I have as an elected official for the district that I serve is that I also want to be its greatest cheerleader. The work that I do is about strengthening the resilience that already exists in these communities, people who overcome the many challenges of the institutional, historical, underinvestment, and sometimes hostile policies against poor people in this city. And so I want to end there. There is a lot of great things happening in Kensington. It is the work of Esperanza Health and Impact Services and ASE, under the leadership of Casey, Maria, and Susan. It is the partners on the ground, the many church members and clergymen. Just this morning, I was on a call with Reverend Buddy from Rock Ministries. We know that some of the things that are happening there sometimes happen despite us, not because of us, but just the love of residents and other folks to step up to the plate. And again, I'm very grateful and thankful for the work that the administration has done and has tried to do over the year, but it hasn't worked. This has been a failed policy. As someone who was doing harm reduction before it was a term, I have the greatest respect for Jose and Prevention Point, and I understand their perspective. I don't have to agree with their perspective. The one thing, as Brooke mentioned through this conversation, is I don't want to engage in the discussion about empathy and support and help, because we're beyond that. I think the residents of Kensington allowed us to put 2 respite centers there. They allowed us to initially put Prevention Point there. They were willing to work with us, and we made commitments, and I say we as a city, and we failed them. And so now we got to restore Kensington. So the conversation is very different. Just yesterday, I was having a conversation with some of the funders of harm reduction policies. And as was stated earlier, many of these folks who study these policies and want to pilot them in Kensington cannot be utilized as someone's pilot for failed policies anymore. It is my job, as it is Councilmember Squilla's job, to protect the residents of Kensington. It is all of our jobs, elected and appointed officials, who work for these residents to restore Kensington. That is my only goal. That is going to be my focus. We have to restore. As Casey said, I hope this is rock bottom. I thought we hit rock bottom 2 years ago. Then I thought we hit rock bottom when we had hepatitis A. Then I thought we had hit rock bottom when we had the pandemic. And then the shootings began. The level of open drug air markets and the 40 to 50 encampments hit. So I hope this is rock bottom. But what I will not tolerate is us doing the same thing. We need a deeper dive into behavioral health services, what we're doing. That dashboard is a step in the right direction. But I agree with Brooke. What we are doing is not working. And if we make a decision that we're going to meet people where they are, and that we understand that they cannot make decisions because they have a mental health disease. And I said this years ago, if they can't make decisions about themselves, they should not be able to make decisions about how an entire community lives. And so that's not an either or, that's an and. So if we've recognized that people are not in their right state of mind, then we need to address them. I give really kudos to Shannon, who's involved in some of this work. And, when she says, look, do a sanctioned encampment somewhere else, just don't impact my child anymore. I think it is time for us to listen to the residents in Kensington. And they do have better strategies, and they do understand this because they live this every single day. So I want to just, again, thank the administration. I know we worked on a lot of items leading up to this hearing to be able to say something different that we've had in the past, to be able to demonstrate to folks that we are listening. But we have a lot of work to do, And just when you look at the ledger, the amount of investment that we're making for the folks who are unsheltered and need support, and then you look at the ledger about what we're doing to invest in the long-term folks that are trapped, it is still not a balanced view. the policies are still not balanced. And that's what we're going to be discussing as we move forward is how do the residents of Kensington feel like we're listening to them and not just subjecting them to failed policies that entrap them and put their children in harm's way. So thank you, Madam Chair. Thank you to all my colleagues who have been supportive. You know, I've been, in this conversation for a long time. Many of you have been very supportive as we've added resources, as we've asked for policy changes. But I will take nothing different than removing all of these services that we've not been able to manage until they're removed from the corridor, until we reduce at least by 50% the needle exchange, and we make this citywide. This has to be citywide. Kensington can no longer be the guinea pig, failed experiment. Poor people of color, working class communities should not be subjected to it. And in this space of social justice, when we talk about equality and disparities, the health disparities that we saw here, whether it was testing for COVID and other things that eventually we got, this administration has to demonstrate in Kensington that it has heard the civil unrest, that it has heard the cries of these residents of Kensington. So thank you to Councilmember Squilla for always partnering with me on this work. We don't have all the answers and we don't have endless resources, but we got to work smarter. Working hard is one thing. Working smarter is where we have to go. So thank you, everyone. Thank you to all my colleagues. Thank you, Madam Chair.
Thank you, Councilwoman, and thank you for all of your hard work for years and years and years to make a difference in the community. So we really recognize that, and thank you so much. I want to recognize Councilman Derek Green and then Councilman Alan Dom for brief remarks. Councilman Green?
I'll be very brief. I just want to thank you, Madam Chair, for holding this hearing. I know we've had these hearings in the neighborhood over the years through this committee, and I just want to thank my colleague, Councilmember Maria Quiñones Sanchez and Councilmember Squilla, who have been working on this issue for a very, very long time and working collaboratively and being advocates for so many residents in the community, like Brooke Feldman and Shannon Farrell, and all the other organizations, like Casey O'Donnell from Impact and Maria Gonzalez from HASE and Esperanza. Really appreciate this conversation. And as we go into 2021, hopefully we'll be moving in a new direction through all the energy and passion and work that all the advocates, as well as under the leadership of Council Member Sanchez, have taken to try to address this issue. So thank you for a very engaged conversation and it demonstrates we still have so much more work to do as we go into 2021.
Thank you, Councilman. Chair recognizes Councilman Dom.
Thank you, Madam Chair, for hosting this also. I want to echo my colleague, Councilman Green's comments. Councilmember Sanchez and Councilmember Squilla, thank you for everything you've been doing here. And I just want you both to know that whatever you need from me, I will be available. I'll do whatever I can to support you both. I drove through on Sunday afternoon at 4 o'clock this past Sunday. I drove up from Girard Avenue, up Kensington, and got all the Kensington Allegheny, and what I saw was horrible. It embarrassed me as a resident of the city to see that going on. So you're absolutely right. We have to do better. This is unacceptable. The amount of trash I saw Sunday afternoon, the people hunched over, it was worse than a third world country, worse. And it's a disgrace that we're allowing this to happen. We have to fix it. So I stand with both of you. Whatever I can do to help, please call upon me. I'll be happy to help and do anything I can. It's just heartbreaking to see that. So thank you for everything you're doing, and thank you, Madam Chair, for this hearing. Thank you.
Thank you, Councilman. Councilman Squilla? Chair recognizes Councilman Squilla.
Thank you, Madam Chair. Just a quick comment, and I want to thank my colleagues for hanging in here the whole time. It's an important issue. It's something that, is no longer just associated with Kensington. And, we really need to make sure that people realize that, this could be every neighborhood in each part of our city of Philadelphia if we don't come up with a solution. So I wish I had the answers right off the top of my head, but I don't. But working together, I think we'll come up with it. And as long as we're willing to adjust and change and try new things, I think we'll get to a point where we'll see positive results. So thank you all for, indulging us on this, and we appreciate all your support and thoughts, and hopefully we'll see some positive results in the future. Thank you.
Thank you, Councilman. And I see also, I just wanted to recognize that we did have greetings and statements of support from council members who are still with us. Councilman Isaiah Thomas, Councilwoman Helen Gim, Kendra Brooks, Councilman David O. So we want to thank all the members of the committee for hanging in. It's been a really long day today, an exceptionally long day in City Council. So we do thank everybody for staying in and listening to about 9 hours worth of testimony today altogether. So that being said, and seeing that there is no one else here to testify on this resolution. One moment. I want to thank all the panels and witnesses for their participation today. We value your opinions, and this concludes the public hearing of the committee. We will now recess this hearing until the call of the chair. I want to thank you all very much for your attendance, and be blessed and be safe. Thank you so much, everyone. Take care. Bye-bye.
Thank you, Madam Chair. Good job.